Good morning, good afternoon, and good evening, everyone. I'm Lubna Dajani, Chair of Catalyst Now USA Chapter and Managing Director of Ultimate. It is my honor to welcome you to the inaugural day of CCW2025, a day dedicated to mental health, well-being, and the undeniable role of art in social change. Around the world, mental health challenges affect nearly 1 billion people. That's right, about 13.6% of our global family. Anxiety impacts 284 million, depression reaches 264 million. And more than 700,000 lives are lost to suicide each year. The economic cost, over $1 trillion. Still, only 9% of those diagnosed with depression receive treatment. These numbers only stand to remind us how deeply this impacts each and every one of us. But today isn't only about the challenges. Today is about how we can change the narrative. Across the globe, artists and social innovators together are building models of care that are accessible, inclusive, and are rooted in real lived experiences. Technology extends our reach and unlocks our hidden creativity. And art isn't just a reflection. It's an active force in healing and connection. Art turns stigma into understanding, and it opens safe spaces for sharing. It sparks compassion and mobilizes communities for social change. Today, you will see and hear how artists and innovators are using culture and imagination through music, storytelling, and visual arts to challenge norms, change narratives, and spark new possibilities. By caring for each other and by competing to complete each other's work to a common goal, and by embracing empathy, imagination, and creativity, we can truly reimagine the systems that are shaping our world today. I welcome you, CCW 2025.
Hi, everyone. Welcome to Powering Safe and Healthy Starts, Action for Maternal and Infant Health, Catalyzing Change Week event. I'm Hannah Schulman. I'll be the moderator for this session today. Thank you all so much for joining. And thank you, Denise, for getting us started with that welcome video for today's theme of mental health and well-being. I'm going to start sharing my screen. Great. So for those of you who aren't already a Catalyst member, please consider joining. They've put on this wonderful week of events and are here to co-create spaces where the world's social innovators connect, collaborate, and contribute to transformational change. So please consider joining if you haven't already. Before we get started, we're hoping that people will go to menti.com and use this code to join so that we can have an interactive session with our participants later on. So if you are able to, you can scan this QR code and join on your phone, or you can go to menti.com and use the code on the screen here to join. And we'll give that a few minutes. And I'll introduce the session while people are starting to join. So today's session is hosted on behalf of the Safe and Healthy Starts collaboration, which is a new Catalyst collaboration to bring together practitioners, advocates, and innovators working across sectors to improve maternal and infant health. This session is designed for co-creation, not just a panel. So you will hear from some incredible leaders today, but your experience and expertise is just as important. And during this session, we're hoping to explore how our diverse work connects and where our efforts intersect so that we can build collective, sustainable solutions that support safe and healthy beginnings for mothers and babies everywhere. So I'll move forward here. Okay, so I see we have a couple of people who have already joined. That's great. We'll give another couple of minutes to see if anyone else is able to join and add to the Mentimeter. But yes, while people are joining, and please stay on the Mentimeter. We'll leave for a bit for our panel discussion and then come back for our audience engagement portion. And during today's session, you've heard from the Catalyst team about today's Catalyzing Change Week theme of mental health and well-being. We'll hear from some leaders of the Safe and Healthy Starts Collective. We'll learn from our panelists about their work and contributions to maternal and infant health improvements. And then we'll all join in and discuss together and reflect on our own work and how it impacts maternal and infant health, and begin to discuss opportunities to collaborate for additive impact for maternal and infant health. Okay, so it looks like some people have joined the Mentimeter. That's great. You can continue joining, and we'll have another opportunity later on to join. Okay. So some brief housekeeping for this session before we begin is, if you're able to, it would be great to have your video on if possible. We'd like for this to be co-creating space and yeah, a good conversation with everyone. So if you're able to have your camera on, that would be great. Show your name and company. If you're able to, you can click on participants, click on your name, and then rename in order to do this. If you're speaking or engaging with the panelists, please unmute when you speak. If you have any technical questions, you can go to zoom.us/support or raise your hand, and I or one of the Catalyst team members will support you in that. And lastly, just enjoy. We're very excited to have everyone join this conversation and get started with some ideas for the Safe and Healthy Starts collaboration. So without further ado, I'm going to introduce our co-host, one of our co-hosts for the event, George Mike Lubaranga, who works with Solar Health Uganda. Before heading into our panel discussion, since this is on behalf of the Safe and Healthy Starts Collective, George Mike, could you introduce the Safe and Healthy Starts collaboration that was the inspiration for this event? Where did the idea for the collaboration come from? And can you tell us a little bit about the goal for the collaboration? Thank you.
Thank you so much, Hannah. It's really a pleasure. The Safe plus Healthy Starts collaboration is a joint initiative led by Solar Health Uganda and co-hosted with Let There Be Light International. It's dedicated to tackling the interconnected challenges affecting maternal and infant health, particularly in underserved, rural, resource-constrained communities. This collaboration is open to a global community that is of persons from CBOs, from NGOs, researchers, scholars, government leaders, students, and individuals with an interest in maternal and infant health, especially those working in programming, advocacy, research, and those simply curious to learn more. The idea was born from the need to bridge siloed efforts and bring together diverse actors from healthcare, energy, WASH programs, nutrition, education, and community development to work collectively in order to improve maternal and infant health. The goal of this collaboration is to create a shared space for knowledge exchange, connection, and collective action. This collaboration brings together diverse stakeholders to discuss the interconnected challenges affecting maternal and infant health within their own communities share experiences, and identify effective strategies for change to improve the status quo and strengthen systems that support safe and healthy beginnings for mothers and infants. Thank you, Hannah.
Fantastic. Thank you so much, George Mike. Yeah, so that's been the inspiration for this event today and the context for the conversation that we're hoping to engage everyone in. I think we're ready to get started. Let's just jump into our panel discussion. We have a handful of really great panelists here with expertise in different areas of maternal and infant health. So I think if we can just have our panelists introduce themselves. We're adding them to the screen now. If you could introduce yourself by saying your name, where you're located, the organization that you're affiliated with, and a little bit of an overview of that organization and your role there. Let's get started. Let's keep going with George Mike and we'll pass it off.
Yeah, thank you again, Hannah. My name is George Mike Ruberenga. I'm based here in Uganda. I work with Solar Health Uganda, and where I'm responsible for evaluations, outreach, and administration. Thank you. Nice to be here.
Thank you. Can we move to Carol, George, your coworker, George Mike?
All right, thank you, Hannah. I'm Caroline Mwebaza. I also work with Solar Health Uganda. We are based in Wakiso, Uganda, and I work as the Health and Education Director. And like my colleague has said, we do outreaches, that is the solar light distribution outreaches, education, but also evaluation of the projects. That's what we do.
Thank you. Dr. Radhika?
Hi, everyone, and thank you to Catalyst Now for letting me be a part of this distinguished panel. My name is Dr. Radhika Batra, and I'm a pediatrician and neonatologist from New Delhi, India. I'm the founder and president of Every Infant Matters, a global nonprofit working towards ending malnutrition in children under 5 and expectant mothers in the underdeveloped and developing countries. Thank you.
Great, thank you. And Charity?
Hello, my name is Twesige Charity. I'm a midwife working from Chankwanzi District Local Government. The Chankwanzi District is a district found in Uganda. It's located in Midwestern Uganda. Thank you.
Fantastic, thank you. And we have one other panelist who we're hoping might be able to join us at some point during the call. He's having some problems connecting. So if we have another voice join us, it will be Alpha from Population and Development Initiative, Tanzania. So hopefully you will hear from him in a bit. To get us started with the panel, could everybody touch on what is the perspective that you bring to maternal and infant health, and how specifically is your work impacting maternal and infant health? We'll start with Dr. Radhika.
Hi. Thank you for this very interesting and important question, Hannah. And I think the perspective that we bring to the table is about prevention. Because there are many diseases in the maternal and infant space that we cannot prevent. There are congenital disorders that babies are born with, or there are cancers that we have no control over. But we feel that it is a travesty of justice that we lose mothers and children to preventable causes. And children become blind due to, irreversibly blind due to completely preventable aspects like deficiency of vitamin A in their diet. So our focus has always been preventing and treating preventable causes of maternal and infant death, and making sure that access to healthcare is not what is causing a problem. It's not that children are dying because they can't access healthcare services, or they don't have food to eat, or they don't have vaccines available. That has always been our perspective at Every Infant Matters. And our flagship project, like I mentioned, is about giving children vitamin A to prevent them from going blind. And we started off with the flagship project, but in the process of our work, we realized that just giving vitamin A is not enough, because the health of a baby always begins with the health of a mother. And a health of a mother is only possible to maintain if we start when the girls are young, when they are adolescent girls, when they start menstruating and losing blood. That is when they become anemic and they lose nutrients because of bleeding, and because of a lot of gender disparity in households, in communities like ours, where the boys get preferential treatment and they get the food which is better, and the girls are left to starve. So, if we want to break this vicious cycle of anemia and malnutrition, we have to start with these girls. We have to make sure that anemia is detected and treated timely, that nutritional reinforcement is given during pregnancy and lactation. And only then will the baby be born healthy and not be prone to severe acute malnutrition and its horrible complications, including irreversible blindness. So, that is the perspective and the problem that we aim to tackle and remove from this world completely in a few years. Thank you.
Thank you so much, Dr. Radhika. Yeah, I think that the perspective of very practical solution with the vitamin A, but thinking about the full cycle of impact and how where we really need to be targeting is really great to have that part of the conversation. And I think relates, though you come from a different perspective, George, Mike, and Carol from Solar Health Uganda, this idea of preventative measures and access to healthcare are part of your perspective as well. So if you could touch on that, George, Mike, or Carol, talking about the perspective that you bring to maternal and infant health problems, that would be great.
Yeah. Thank you so much, Hannah. What perspective that will bring to maternal and infant health? We are working to address energy poverty, which affects rural off-grid communities. And by doing this, we are bringing solar power to health centers, off-grid health centers, and also giving mothers who are delivering at these health centers portable solar lights, which they take home to care for their families, for their newborn babies and the other children at home. And by doing so, we are helping to prevent respiratory health complications, conditions. We are also ensuring safety of these of the mother and the newborn baby when they are back home. But also, we are preventing the occurrence of complications while delivering at a health center without solar lights. And also the other things that we are incentivizing these mothers to receive these lights. We are doing this as an incentive for the mothers to come to these health centers, to encourage them to come for the health centers for antenatal and delivery, which helps to reduce cases of mothers dying in the communities, being attended to by other persons other than the trained health workers. So this is helping to reduce. We have seen over a couple of years that, for instance, at Butawata Health Center, that I would say, I'd give as an example, they have moved from April 2021, when they had only 17 births per month, moving to between 57 to 80 births in a month lately. So, which is a very good improvement, and it shows that mothers are able to, get the quality care that they need to get in staffed health centers. Thank you.
Thank you for touching on also the impact of energy access and maternal and infant health, and how that is the context for which you work. Charity or Carol? Before we move on, I see a hand. Yes, Sarah Baird. You can go ahead and ask your question.
Thank you. Hi, this is really, really interesting. And I'm affiliated with Let There Be Light International, which works with Solar Health Uganda. But listening to Dr. Batra's explanation about the importance of vitamin A, it strikes me, I'd love to hear from Charity, who's a nurse in the field, about this overlap, because I know that in Uganda, vitamin A deficiency is a serious health problem, and it exists with energy poverty. So as we're talking about these collaborations, I'm just really curious about, because we see a lot of blindness in sub-Saharan Africa and energy poor families because of indoor air pollution, and we see more infant mortality because of pneumonia and diarrhea. And I know that vitamin A deficiency can lead to more higher rates of mortality. So I'm just really excited about hearing about this, and also, looking in the future, in an ideal world, would there be any way for us to try to pair these things? So thanks so much.
Great, thank you so much for that question. Dr. Radhika, if you have a response to that.
Hi. Thank you so much, Sarah. And I'm sorry, I couldn't catch the last part of your question. Were you asking if it's all interrelated? Is that what you meant? I'm so sorry, I couldn't catch the last part.
That's okay. Sorry. No, I recognize that they're interrelated. I'm wondering,
Yeah,
as Catalyst is creating these communities where we can come together and discuss these
yeah,
interrelated things, I have absolutely no idea how difficult it is to promote, access to supplementary nutrition or vitamin A, or even just teaching our communities when we're out in the field working with energy poor families about the importance of a diversified diet if we can't get supplements. So I'm just wondering, are there maybe number one, are there places that kind of pair these things? It seems so different. Energy access and vitamins seem like they're different things, but clearly they're very interrelated.
yeah.
And if there aren't projects like that, that would be pretty interesting for Catalyst to have catalyzed an idea to try it somewhere.
Yes, definitely. So there's a lot of scope where projects can be built around this intersection of health and energy and climate change. Because as you know, that health specifically for children and expectant mothers, because you see, a fetus is still developing and a newborn is still growing. So at that time, any changes in the climate, or any disaster, or any air pollution by fossil fuel burning is very, very disastrous. So definitely there's a lot of scope for collaboration, and I would love to brainstorm with you on how we can come up with a sustainable solution that integrates these two or three aspects of, and build a holistic project around it. So for instance, I can give you an example, not related to energy as such, but we are doing rainwater harvesting in areas where there was a very high rate of waterborne diseases in India, and a lot of fluorosis because of contaminated water. So we set up these rainwater harvesting units, which puts rainwater through a filtration system and makes it fit for consumption. So that has brought down the rates of waterborne diseases in the areas where lots of children were dying of typhoid and cholera. So just as an example, and I'm sure we can build something around the solar light, or something to do with energy conservation as well. Does that answer your question?
Yes, yes. I also would love to hear from Charity about, like, do you see these interrelated problems? Do you see, vitamin deficiencies as well as energy poverty coexisting, and what is the impact on the mothers and the newborns?
Thank you, Sarah. According to my community where I work with, Uganda has very good climate. Like people do farming and they have a lot of food around the community. So currently we haven't seen many people experiencing the vitamin A deficiency. Then the government also tries like to help combat vitamin A deficiency, like every mother who gives birth is given a booster dose of vitamin A before they go home, and every child is given vitamin A for every after 6 months in the first years of life. So we are not experiencing the vitamin A deficiencies currently in our community, since I live in a local community. And the main source of food is farming, and the locally farmed foods contribute much to prevent the vitamin A deficiency. Thank you.
Thank you. This is really wonderful because the purpose and goal of this conversation and the collaboration, Safe and Healthy Starts collaboration, is to find ways that all of these different issues intersect for maternal and infant health. So how nutrition and energy access and healthcare delivery are all related and interwoven, and that we can work together um, to even further supplement each other's work is really a beautiful thing, I think. So I would also love to hear more from Charity about beyond the vitamin A deficiency. Could you speak more about your experience in local communities working with mothers and the um, biggest issues you're seeing with maternal and infant health right now in your communities, and the interrelated issues that are impacting maternal and infant health?
Thank you, Hannah. Currently, as I'm a midwife practicing in a local and rural community, we are currently having a lot of challenges, though some have been solved by providing us with safe energy by Solar Health Uganda. We really appreciate, but currently we have poor road networks. Though we are trying to improve maternal and infant health outcomes, take for example, me as a midwife, like in most cases, we offer antenatal and delivering mothers from the community. They come from very far away, and the road network is always poor, whereby you find sometimes that the roads are impassable, like the mothers can't cross to come to the health facility, or it is very far in that they can't access a vehicle to bring them to the health facility. So those mothers who can't really reach at the facility, they always get complications. There are sometimes they die, they can get fistulas after birth, or sometimes they even have to wait until it is the time to access the facility. And we've seen most of them coming to the facility when they are in severe conditions, maybe sometimes reversible, like severe birth asphyxia, which has already caused brain death, which is quite challenging because as the facility, we really can't do much. If we can't access the places, even the mothers can't access the places. We would have loved to always go there. We initiated something like the community outreaches, whereby a midwife goes there and finds a mother in the community, mostly to give antenatal services. But for the deliveries, still it is quite a big challenge. We are still getting complications. My babies are dying, and mothers are really suffering and getting complications. That is one of the most disturbing things which is happening in our community. Thank you.
Thank you. A few follow-ups from that, but maybe Carol, could you speak to your energy access programming and electrification of clinics and how that is impacting access to health? Yeah. Oh, you're on mute.
Thank you, Hannah. So through our program, of Safe Birth Plus Health Homes project, it is divided into 3 components, and one of the components that we first do is electrifying the health clinic, because mostly many rural clinics here in Uganda are really off-grid, and also many homes here in Uganda are really suffering from the poor lighting they're using their homes. So one of the things that we first do as we think of the Safe Birth Plus Health homes is electrifying the health clinic such that the health clinic is accessible to the expectant mothers, so that they're able to access the clinic throughout the 24 hours of the day, but also creating a safe place for delivery, in that the midwives are able to conduct these deliveries in a safe environment, but also improving the working conditions for the midwives. So through our electrification of the health center, we see mothers are able to access the health clinics, but also we provide that safe environment for the mothers. But also there is the incentive that we give to the mothers at discharge. They go back with a solar light, which solar lights help us to replace the dirty polluting energy sources that have been using, because we work in areas which are really off-grid, and these mothers have been using kerosene lamps, they've been using candles. So giving them a solar light to go back with at home helps them to replace that with the dirty polluting energy sources that have been using, which help them reduce on the air pollution. But also we see mothers really after birth, their health is really their health-wise, that really very low. And also the babies also, they are really at risk of contacting respiratory tract infections. So giving them a solar light, and then they're able to have a clean air. They're able to, feel safe at night, because the mother is not worried about maybe the candle, the net will catch fire because I'm using a candle or kerosene. So the mother sleeps well. The baby takes care of the baby very well at night. So giving the mothers really this solar light to go back with at home really helps them to improve their health, their mental health, physical and emotional health. Yeah, but also their babies. Thank you.
Thank you so much. I think you've touched on, and all of our panelists so far have touched on, the importance of intervening for maternal and infant health at the antenatal stage, at the birth event, and then after the birth to support mothers and infants' health after they go home. And I think that, yeah, even Dr. Radhika, you talked about much prior needing to work with women and girls when they're young to support maternal and infant health. And we have a question to that, asking from Matthew, what are you doing for empowering women who are planning to become a mother? Is there outreach strategic planning for that? And I see you've responded in the chat, but if there's anything else you want to add to the importance of that outreach and empowering girls and women before becoming mothers.
So, of course, there is this aspect of antenatal counseling and nutrition that is in play here. Because if the mother's health is not good to begin with, we can't expect her to deliver a healthy baby. So, essentially, what happens in countries where the women are neglected and they are fed last in the homes, and there's a lot of gender disparity. What happens is that the girl is nutritionally starved to begin with, and then she starts losing blood in her menstrual cycles, and the anemia and the malnutrition multiplies tenfold if she when she becomes pregnant with the baby. So naturally, the fetus is starved of nutrients as well, and it's a low birth weight baby that is born in this world, which is now 3 times likely to be severely malnourished, to go blind before its fifth birthday, or die. And not just that, there is a correlation of low birth weight with metabolic disorders like diabetes and hypertension later on in life. It's called Barker's hypothesis that a baby that is born low birth weight is prone to these diseases later on in life and adulthood. So essentially, by not treating the mother, or by not treating the girl, and by neglecting the girl and not giving her food to eat, the entire disease spectrum of the world is shifting towards the negative side. So to break this cycle, there is only one and only one way, and that is to empower these women, to give them better nutrition, to detect anemia and malnutrition in them at the early stages. That is when they are in their teens. That is when Every Infant Matters is detecting anemia by using a non-invasive AI-based hemoglobin scanner, and we are detecting anemia in the most remote parts of India, and we are treating the anemia, providing nutritional reinforcement in the form of iron supplements and other nutritional high protein diets, and also supporting the mother throughout pregnancy and lactation, and then letting the cycle break. Another important thing to remember is that a mother who's malnourished is going to produce thin and insufficient breast milk. And a lot of times, the breast milk is the baby's only and the best source of nutrition. So if that becomes thin and insufficient, the baby worse, the whole matters become much worse if the breast milk is not good. So that's another point to keep in mind.
Thank you. Yeah, we have a follow-up question too. Matthew says, I think the failure is not in awareness, but it is due to poverty. The woman will feed everybody in the home and there's nothing for her. The family members should understand and support here. What is the strategy to feed the pregnant women by the family? Is there any program for family members? If you have a response to that, Dr. Batra. Yeah.
So, of course, this is a very, very valid point that the family members are not aware. And as a part of our antenatal counseling, our health workers, along with the health workers of the government, we formed like a comprehensive team, and they go door to door and they educate these families that this is what will happen if the mother is not healthy. And they make sure that the girl child is not discriminated against. They make sure that she's given proper food to eat since the very beginning. So there's a lot of counseling being done using AI generated videos in the local languages as well, so that the message is taken across. And the health workers that we hire are from within communities. So, for instance, if a outsider was to go in a tribal close knit community and preach a message of gender equality, it will not be accepted well. But if someone from their own community gives that message, and we even empower the socio religious leaders of a particular tribe or a particular area to give out these messages of equality and nutrition, and that we have noticed is very well received as compared to any other intervention or anybody else going into these problems with them.
Thank you. Yes, I think that's a very important point too about locally embedded programming and advocacy. Also, well, we're talking about poverty and the impacts there, specifically on nutrition. I'm wondering if George Mike, maybe you can speak to as well. There's some interlinkages there between poverty and nutrition and energy access. If you would like to speak to that.
Yeah, absolutely. The interlinkage lies in the VACTI. Actually, most of the people that have participated in our joint programs with Let There Be Light International and the off-grid communities, we find that these are the most of the homes that are affected by food insecurity. And why is that? It's because most of these homes are the ones that you find that they have a small piece of land where they have their house, and just a small plot is left for crop farming. And there are also several of them who are renting land where they have their houses, and they don't have such big land for crop farming. So it depends actually. There are so many areas and where you find that now, if we look at areas like Amolata, you find that some of these areas, they are mainly close to the lake, where the main activity is fishing. And when you look at mothers, they are the people who carry the burden, of thinking about what the family is going to feed. And actually, when it comes to places like northern Uganda, I'd speak about Amolata, that particular district, is because is where we find that in the culture, the women have to do like it is known, and the men have to just stay there waiting for the woman to bring food. And so we find that this be it that where economic activities and don't favor the women, like the fishing, the mother cannot get into fishing, but the men can get into fishing and make their money, and then they use it for other things. So you find so many mothers who don't have, they are unable they can't fish, and so they don't have a source of income, and they can't cultivate the land because also the terrain of the land is not fit for crop farming. But also the other thing is access. So people who are living in energy poverty don't have access to a land that can do favor crop farming. Even if people actually, when we talk about subsistence farming at the level at which it is in some of the communities, is that people who are doing subsistence farming, they can't feed themselves throughout the year. What they earn, actually they end up even selling some because they need some income, but at the end of the before even the next harvesting season comes, they don't have what to feed the family. So you find that there is a linkage there, because we are looking at households, how many households that we meet that are unable to raise an income of 10,000 shillings throughout a week. There are so many of them, and there are many times when we ask, how do you live, how do you survive? And that's something that because you are looking at the light, they really need the light. Like I would give an example of a woman that we met on one of the slopes in Mbale, in Slonko, where we found that they were using a reed, a papyrus reed, like a reed from, actually it was from corn, these residues from a corn when they cut the corn. And that's what they are using, to light the home. And looking at even where the house is and what you don't see, because actually how you could see that sometimes, as for us who go on the ground, and look and visit these homes, what you usually look at and you say, okay, this family is not badly off, because they have some space for farming, and they have some some planted crops and all that. And also you could look at the nature of the house and all that, and what are they been using. Actually, people who are using these disposable torches, we find them that at least for them, they are, well off. But you find we have seen so many people who don't have who sleep. I'm sorry for taking long, but I just wanted to give just an example from our last trip when we were in Luel. We found this family where these people have to, have their meal earliest by 7. So we had to drive these kids from a school and meet their family, and it was late, and we had to give them a ride. And actually we wondered how they walked from home to school, because it's a long way, but we had to drive them there. But getting there, you see the family, they are having meal earliest. On reaching home, they are like, you should have meal, you have to sleep. So you see that where we are, what we have sort of seen firsthand is that there is a linkage between nutrition and energy poverty. Thank you.
Thank you, George, Mike. And also I'm hearing from your response themes that having a solar light would enable people to have more productive hours. Like you were saying, they can do things after dark more, and the savings from having to purchase alternative fuel sources, that those are also would impact poverty, and then people's ability to nourish themselves and their families. This is great. I would love to keep going with this conversation. I am aware of the time, so we're going to move now to our interactive session, just for our last few minutes. And if you have more questions, please join our collaboration where you can have further conversations with these panelists. Yes, so I'm going to share again. And while I'm about to ask the attendees to join the Mentimeter again, and and choose the SDG that centers both your work and impacts maternal and infant health, because the goal of this session is to begin thinking about interlinkages, and oops, sorry, I'm having some trouble with the screen share, but to think about interlinkages with the SDGs. So we want to think about the way that our own work can impact maternal and infant health as well. So I see 7, affordable and clean energy. Maybe if we wait for some more answers, could our panelists go through and share which SDG is central to their work and improving maternal and infant health? Maybe Charity, could you begin?
My essential SDG is SDG number 3, which is health, good health and well-being for all. As a midwife, mine critically addresses the reduction of maternal and infant health. That is maternal health by 70 per 100,000 live birth, and infant health by 12 per 1,000 live birth by the year 2030. Thank you.
Great, thank you. Carol?
Thank you, Hannah. From our perspective, that is SDG 7, that is working to bring access to clean and safe energy across rural off-grid health centers, but also off-grid homes, so that we improve safe deliveries at health centers, but as well as the health of the mother and the infant as they go back home. Yeah.
Thank you. Dr. Batra, Dr. Radhika?
So, of course, SDG 3 is what relates to our work the most, but I also want to stress on the importance of SDG 17, that is partnerships for the goals,
Mhm.
because like the session is on interlinkages, I also feel like partnerships are the way to attain the goals, and we don't get anywhere without partnerships.
Yes, thank you so much for that. Yeah, so we've discussed SDG right now. We've centered SDG 3 and 7 and 17, but also during this conversation already, we've talked about SDG 1 with no poverty. We've talked about zero hunger and the importance of nutrition. SDG 3, good health and well-being. We've talked about gender equality and clean sanitation, clean water and sanitation, affordable energy. We've talked about work. We've talked about reduced inequalities, climate action and partnerships. So we've touched on just so many of the SDGs, and I'm sure that there are many more that we could touch on if we continued this conversation. But just stressing the idea that there are interlinkages in this work, and that with especially partnering and combining our different areas of expertise and perspectives, that we can improve maternal and infant health through these interlinkages. Are there any participants who would like to share any perspectives on interlinkages or the SDG that they think centers their work and maternal and infant health? And I'm unable to see the chat right now or the screen. So if you do have one, just feel free to unmute and share your thoughts. Okay, in that case, we also want to ask if panelists and attendees alike can join and participate in this slide. We would love to think about what are some important aspects of an effective collaboration for maternal and infant health. So during this conversation, we've centered different issues and ideas that we would like to address and that our own work are addressing for maternal and infant health. But thinking about moving forward with the collaboration, what would be important aspects for you to see in that collaboration? Yeah, if there's a word or two that you would like to add to the screen, and you can submit as many submissions as you'd like.
Hannah, where are we submitting those?
If you're on the Mentimeter,
Yeah,
you should be able, there should be a text box. There we go. Okay. If not, the next plan was to open this up and have people reflect and share their input. Okay, great. So we have knowledge sharing, collaboration, and education. Context. I think that is a very important one for this conversation, and just others moving forward, breaking out of our silos and thinking about the larger picture and context will help us to identify and work in accordance with these interlinkages. Partnerships. Raising awareness. Funding. Healthcare for all. Yeah, these are great, and will help inform our collaboration going forward. So yeah, please keep submitting this. I'll leave this open, and we can continue that within the future conversations. But yes, before I hand it back to just end the session, I want to open it up if there are any last comments from any speakers or any of the participants.
Hannah, there's a question from Matthew
Yeah.
in the chat box that says that the government is giving food to pregnant women, but it is taken away by others, and the problem arises that the women have no food. This is the problem, and the woman will not have breast milk, and the infant is malnourished. So, is there a concrete step to take here? Is what he wants to know. So, of course, there is no other way for the. So, he's saying that the government is giving food, but it's being taken away by others in the family. So, there's no way to fix this unless we fix the collective vision of equality that exists in the world. That a woman, and specifically one who is expecting a baby, needs better nutrition than the rest of the family, or even a little more than what is usually needed by the woman herself. Unless we fix this patriarchy that exists in the society, I don't think this problem can be fixed. And the only way to actually fix it is to start in our own homes and to let it take a ripple effect and go forward from there.
Thank you so much, Dr. Batra. Yes. Yeah, so I think that we are at time. So I just want to thank you all, to all of our panelists, for sharing your insights and experiences. And thank you to everyone who joined and asked such insightful questions. I think that we've touched on a lot of issues surrounding maternal and infant health, from nutrition to energy access, and poverty. I'm seeing our slides are coming up. Yep. So we would love to continue these conversations and then take these ideas and put them into actionable partnerships and collaboration. And that is what we'll be doing with the Safe and Healthy Starts collaboration. So if you would like to be part of making actionable partnerships for interlinked, interdisciplinary group efforts to develop maternal and infant health interventions, please consider joining us. You can sign up on the Catalyst member portal to stay updated on our next meeting and other ways to engage. Thank you all again for attending. And if you'd like to, before you leave, you can add in the chat one word for how you're feeling after leaving today's session, or something that you'll take with you after this session. But yes, thank you all so much for joining us, and hope to see you at the opening ceremony, which I believe is starting now.